Welcome to my channel. Subscribe or like if you like it. Today we will explain the drug CIALIS. We will talk about its side effects, its dosage, contraindications, warnings, its mechanism of action, pregnancy, breastfeeding and much more. What is CIALIS? CIALIS is a drug used to treat erectile dysfunction, benign prostatic hyperplasia and pulmonary arterial hypertension. It is a drug similar to sildenafil, differs from the latter in that the effect of tadalafil is more prolonged, reaching 36 hours, while the sildenafil takes effect for 4 or 5 hours. The active principle of CIALIS is the tadalafil. Mechanism of action of CIALIS. Powerful and selective inhibitor of phosphodiesterase 5, PDE5, an enzyme of the cavernous bodies responsible for the degradation of cGMP. Therapeutic indications of CIALIS. Erectile dysfunction in adults. Treatment of the signs and symptoms of benign prostatic hyperplasia in adult men including those with erectile dysfunction, only for doses of 5 mg. Pulmonary arterial hypertension, PAH, functional class 2 and 3, WHO, in adults to improve exercise capacity, proven efficacy in idiopathic PA and PA associated with connective tissue disease. CIALIS dosage and dosage. Oral route. Adults and elderly people. Erectile dysfunction, 10 mg at least 30 minutes before expected sexual activity, with or without food. If no adequate effect occurs, increase to 20 mg. Maximum frequency 10 to 20 mg per day, 1 dose per day. Not recommended for continuous daily use. In patients who expect more frequent use, at least twice a week, recommended dose, 5 mg per day, at the same time. The dose may be reduced to 2.5 mg per day, depending on tolerability. Benign prostatic hyperplasia in adult men, 5 mg per day, at the same time, with or without food. Severe renal failure, maximum 10 mg. Not recommended with severe renal insufficiency, 2.5 or 5 mg daily. Liver failure, maximum 10 mg. Severe liver failure, limited data, evaluate risk-benefit. Pulmonary arterial hypertension, 40 mg once a day, with or without food. Mild-moderate renal insufficiency, 20 mg per day, based on efficacy and tolerability increased to 40 mg per day. Mild-moderate liver failure, 20 mg, evaluate risk-benefit. Mode of administration of CIALIS. Oral route. A. Erectile dysfunction, administer with or without food. However, you may notice that it takes a little longer to take effect if ingested with a large meal. The intake of alcohol may temporarily hinder the ability to obtain an erection. B. Pulmonary arterial hypertension, administer with or without food. Side effects and adverse reactions to CIALIS. Hypersensitivity reactions. Headache, syncope, migraine. Blurred vision. Chest pain, palpitations, flushing, hypotension. Nasopharyngitis, including nasal congestion, sinus congestion and rhinitis, epistaxis. Nausea, dyspepsia, including abdominal pain/malaise, vomiting, gastroesophageal reflux. Rash. Myalgia, back pain in the extremities, including discomfort in the extremities. Increased uterine bleeding. Facial edema, peripheral edema, fatigue, chest pain. Diarrhea in people over 65. Contraindications of CIALIS. Hypersensitivity. History of cardiovascular disease. AMI in the previous 90 days. Hypotension. Warnings and precautions with CIALIS. Liver failure, evaluate risk-benefit. Severe kidney failure, not recommended. Anatomical deformity of the penis, angulation, cavernous fibrosis, Peyronie's disease, or history predisposing to priapism, sickle cell anemia, multiple myeloma or leukemia. Not recommended in cardiovascular disease, clinically significant aortic and mitral valve disease, pericardial constriction, restrictive or congestive cardiomyopathy, significant left ventricular dysfunction, arrhythmias, symptomatic coronary heart disease, uncontrolled hypertension, occlusive venous lung disease, retinitis pigmentosa. Risk of visual impairment and cases of non-arteritic anterior ischemic optic neuropathy. Before starting treatment, rule out the presence of prostate carcinoma. Not recommended in combination with alpha blockers, doxazosin, or other PDE5 inhibitors or other treatments for erectile dysfunction, or in patients who are chronically taking potent inducers, rifampicin, or potent inhibitors, ketoconazole or ritonavir, of CYP3A4. Risk of priapism. See doctor if experiencing erections of 4 hours or more. Warnings and precautions in patients treated with bosentan or prostacyclins or their analogs. Avoid excessive consumption of alcohol. Concomitant use with antihypertensives, adjust doses of the latter. Effectiveness is not known in patients with spinal cord injuries and undergoing pelvic surgery or radical prostatectomy without preservation of neurovascular bundles. Not recommended for children under 18 years of age. If cardiovascular symptoms appear at the beginning of sexual activity, it is recommended not to continue and inform the specialist. Hepatic insufficiency and CIALIS. Erectile dysfunction, caution in liver failure, recommended 10 mg. In severe liver failure, limited data, evaluate benefit risk. The daily administration regimen has not been studied. Pulmonary arterial hypertension, mild to moderate cirrhosis, after single dose of 10 mg, consider starting dose of 20 mg, evaluate risk-benefit. It is not recommended in severe hepatic insufficiency. Renal insufficiency and CIALIS. Erectile dysfunction, caution in severe renal insufficiency, maximum 10 mg, daily administration is not recommended. Pulmonary arterial hypertension, severe renal failure, not recommended. Mild to moderate renal insufficiency, initial 20 mg per day, based on efficacy increase 40 mg per day. Interactions with CIALIS. Plasma concentration decreased by phenobarbital, phenytoin, carbamazepine, rifampicin. Pregnancy and CIALIS. There is limited data on the use of CIALIS in pregnant women. Animal studies show no direct or indirect harmful effects on pregnancy, fetal embryonic development, delivery, or postnatal development. As a precautionary measure, it is preferable to avoid during pregnancy. Breastfeeding and CIALIS. Pharmacodynamic and toxicological data available in animals have shown excretion of tadalafil in milk. A risk in the nursing infant cannot be excluded. It should not be used during breastfeeding. Effects on driving ability when taking CIALIS. There have been no studies on the effects on driving in machine use. Although in clinical trials the frequency of dizziness reporting was similar in the two treatment arms, tadalafil and placebo, patients should consider how they react before driving or using machines.